Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Good afternoon, everyone. Earlier this week, we reported COVID was a factor in the death of a Nova Scotian some weeks ago. I want to extend my condolences to the individual's family and friends on the loss of their loved one. And today, we're reporting 2 new cases of COVID in our province. Both people traveled outside of Canada and immediately self-isolated upon their return, and they did not come into contact with anyone when they arrived home. However, they may have been in contact with people on their flight. Dr. Strang will have more to say about these cases in a moment. This is a strong reminder that COVID is still here, and without taking proper precautions, even limiting the number of cases can quickly spike. That's why Dr. Strang and I sound like a broken record often when we repeat the protocols. Wash your hands, keep your distance, and today, and going forward, wear a mask indoors. It is now officially mandatory. Now I'll hand it over to Dr. Strang.
Thank you, Premier. Good afternoon, everybody. Our last briefing with you was on Friday, July 24th. Since then, we've announced 1 additional death related to COVID-19, which brings us to a total of 64 deaths. And I do want to express my sincere condolences to the family and loved ones of the deceased. That individual is a female in her 60s with underlying medical conditions, and she lived in the NSHA Eastern Zone area. She was not a resident of a long-term care home. Her case of COVID-19 was previously reported as being resolved. However, she did pass away in May, and the death has been under investigation since then, and just recently it has now been determined that COVID-19 was a factor in her death. So the numbers, our online numbers, have been updated to reflect that death. Moving on, today, as the Premier said, we have 2 new cases of COVID-19. These individuals traveled together outside of Canada. They are in Central Zone. Unfortunately, that they have, as soon as they returned to Nova Scotia, they began the self-isolation protocol. So for those following the numbers, we've had in total 1,069 cases of COVID-19 in Nova Scotia. 63,647 Nova Scotians have been tested with negative results, and we've had now 64 deaths. Fortunately, we remain having no licensed long-term care homes with active cases of COVID-19. And yesterday, the QE2 Health Sciences Center Microbiology Lab completed 456 tests. Today, our mandatory mask policy is in effect for indoor public places, and we've had the policy in place for public transportation and transit for a week now. Our approach around masking is based on 3 key areas: the policy itself, our communication around that policy, and ensuring people have access to masks. So let me talk about each of those 3 areas. Many people are wondering why we're doing this now when we have no active cases of COVID-19, and I'm getting lots of questions. Why didn't we do it in March when our first cases arrived, or later in the spring when we had our peak? It's simply the fact that our position has changed because the evidence on both the virus that causes COVID-19 as well as the effectiveness of the use of masks by the general public has evolved. We now have evidence and expert recommendations that the general wearing of masks is effective in reducing the transmission of the SARS-CoV-2 virus. So adapting our approach as evidence evolves should be seen as a positive rather than that we were wrong at some point in the past. The reason that it's important to make masks mandatory now, even with few active cases, is part of being prepared for the likely occurrence of a second wave. It's not about the epidemiology today, it's about what's likely coming. We've all seen what's happening around the world, and there likely will be at least a second wave and maybe more. So living with COVID is part of our new reality. Changing behavior around things like masking takes time, so we need to start making masks a habit now. We've done a good job of forming habits around hand hygiene, cough etiquette, physical distancing, and staying home when we're not feeling well. So we need to now add masks in indoor places to that package of public health measures. And we need to stick to all of these measures together for the foreseeable future. That's what's going to keep us and our loved ones safe. It's what will allow us to keep our communities, our society, and our economy as open as possible if and when we get a return of COVID-19. Everyone knows how important masks are. We need everybody to know how important masks are, so the communication around this is critical. We've put mask information and resources on our website. We have things that are on there. We have a sign for businesses that can they download that and post that in all their entrances. We've got information on how to wear a mask properly, how to choose, know what a good mask is, and how to even make an effective homemade mask. So if you go to our coronavirus website now, we now have a mask section on the very front page that you can click on to take you to all that information. We're also sharing all this information through all the channels that are available to us for communication. Our website, all our social media work, advertising, all our updates to various stakeholders. I was on 2 large webinars with stakeholders earlier this week, as well as answering any individual questions that come into government. We're asking members of the media like yourselves, businesses, workplaces, and industry associations, as well as individual Nova Scotians and their own use of social media that can help spread this message as well. For an example, we have now created a common sign that we've sent out a PDF to that sign, and we're asking all businesses and anybody who operates a public space, ideally we'd have that sign on every entrance into a public space, and the common signage will be an important and frequent reminder to Nova Scotians. It's also important that as Nova Scotians become aware of the mask requirement, that they have ready access to masks for themselves and their families. Most of us will be able to buy masks. Many of us have already done so. There are certainly many small businesses in Nova Scotia that are now making them. So it is an opportunity for people to follow the theme of buy local when we're looking for masks. As I said earlier, our website also also has a link to information from the Public Health Agency of Canada about how you can make an effective homemade mask on your own. But it's important that, as I said, that all Nova Scotians have ready access to masks. That's why we've taken some steps ourselves as government to support that. So we have, as was announced yesterday, we're now providing all our provincial libraries and the 24 provincial museums that are open with some masks, and that's a point of access to people who, whether because they can't afford it or have some other reason they can't get a mask, they can go to their local library or provincial museum and request a mask for themselves and their family. We've given supplies of masks to transit and to taxis. We've distributed them to places such as our homeless shelters. We have supplies of masks at our access centers at another place where people can get them. And when we open schools, we'll have a supply of masks there as well. And in addition to that, we have an email address that is small businesses who need help getting a supply of masks, they can send an email in, they'd be made aware of that, and they can get a supply of masks as well. So we've done many, many things in government to make sure that we are supporting ready access to masks. These are all reusable non-medical masks, and so we're not going to be supplying these masks indefinitely, but this distribution is an important initial effort to make sure that, that access to a mask is not a reason for any Nova Scotian to not be wearing a mask. I know there's been many questions coming up around masks. It takes people time to get used to them, so I'm just going to cover a few of the key and common questions that have been coming up. First and foremost, I want Nova Scotians to use this as a general rule of thumb, that when in doubt, wear a mask. If you're not sure, always err on the side of caution. If you're in an indoor place and you're not sure, we ask everybody to always have a mask with them, and if you're not sure, do the right thing, be safe, and put on a mask. So we need to now get in the habit, along with our wallet, our purse, our car keys, always have a mask, whether it's keeping one in the car or at the door, wherever you keep those other things that you take every time you go outside of the house. We've adopted hand washing, physical distancing, and limiting our social contacts, and now we need to adopt the carrying of masks and wearing them where appropriate and necessary as part of our daily lives. Some people are wondering if it's safe to wear a mask for long periods, and the short answer to that is absolutely safe. However, if you're wearing a mask for a long period of time and it becomes wet or soiled, then you need to change a mask. But when you think about it, there are many healthcare professionals who wear masks for long periods of time every day they're at work, and sometimes their days can be very long. So prolonged wearing of masks is not a safety issue. If you're wondering if you need to wear a mask at your work, ask your employer. Masks are required in many workplaces under the public health order, but even if they're not, if your workplace is not defined as an indoor public place, your employer may well have a mask policy as well. Some people are wondering if they need proof that they have a medical condition that would prevent them from wearing a mask, and we are not asking for proof. We are not setting up a system. Nobody would be required to go get a medical certificate. We're not going to put that burden on our healthcare system. So we're asking employers and businesses to take people at their word. There might be some people who take advantage of that, but I believe that most Nova Scotians are prepared to do the right thing and to wear a mask if they can, and will be honest about whether they need to wear a mask or they're able to wear a mask or not. Some people are also wondering about what exactly is an indoor public place versus a private business space. Indoor public places can be both private or publicly owned, but they're places where the public is fully expected to be and has ready access to. So anywhere where members of the public can go without needing to have a membership, without needing to have a security pass or anything like that, where the public has ready access, whether it's owned publicly or privately, that's considered an indoor public place. So, for example, the public has free access to the lobby, elevators, and hallways of many office buildings. So those are public places. But they don't have free access to the actual office space of that business. So those are considered private. If you think of retail spaces, so take, for instance, a clothing store, where you're in the shopping area, that's a public space, but the public doesn't have access to the back rooms, the supply rooms, et cetera. So those are not covered by the order. The same is, we've got a lot of questions about a car, for instance, around a car dealership. So if you're in the showroom or the waiting area at a car dealership, that's a public place. But the service bays or the back offices are not a public place, and so any workplace policies would apply for those. The mask requirement applies to spaces that the public has ready access to and not private spaces, as I've said. But we are encouraging business owners and employers, they can set their own policies for private spaces, and we would encourage them to also use mask use in their common spaces. So I've used the example of my department. We've gone beyond the public health order, and even in what are so-called the private spaces of the Department of Health and Wellness, we now have any staff and visitors in our common spaces in that office we now have a policy of wearing masks. I just want to clarify, because it's come up as questions, that for rented meeting rooms or halls or other similar places that hold events or gatherings, they are considered public places. But we have created an exception for private business meetings of up to 50 people. So if you're having a private business meeting, you're going to a hotel meeting room. If you're 50 people or less, we're considering that a private space. But if you're hosting a big wedding reception or something in that same hotel, and that you are part of are classified as a gathering under the public health order, and mask wearing would be required. Yesterday, the Council of Nova Scotia University Presidents issued a statement requiring everyone arriving on campus to have a mask, and each institution is going to set policies that will detail where and when masks need to be used on their own campuses. I really would like to applaud and thank Concept, as well as all the other employers who are taking steps to keep their employees and the surrounding community safe through masking policies. Many businesses have invested in plexiglass barriers for their employees, but plexiglass does not replace the need for masks because the virus that can be carried in the air can go around, over top, underneath the sides of plexiglass. So again, plexiglass does not replace the need for masking. However, an investment in plexiglass has not been wasted because the plexiglass adds an additional layer of protection, and especially when people are directly face-to-face and there's direct breathing or somebody's coughing or sneezing, the plexiglass adds that extra layer of protection, but again, it does not replace the need for masking. The same is with face shields. Many businesses have given employers face shields to wear. The face shield cannot be worn instead of a non-medical mask. It can be certainly supplement a mask, but a face shield or eye protection protects the eyes of the wearer. It doesn't stop virus getting out of their nose and mouth like a mask does. So just like plexiglass, if people want to wear a face shield or some eye protection in addition to a mask, that they can certainly do that, but a face shield or eye protection does not replace the need for a mask. I've also, it was brought to my attention yesterday that there's a company out there with they've created a clear plastic mask that's being marketed. They're saying it lets you show your smile. Unfortunately, when you look at it, it's really like a face shield. It doesn't fit tightly around the nose and the mouth, so it's not an acceptable mask because a virus could easily get out and escape around the edges. So it's important that people have information on what an acceptable mask is, and we have that on our website. And if you're worried about your smile, that when you wear a proper mask, people will still be able to see the smile through your eyes. Many people are also wondering about how masks can be mandatory if we're not going to enforce this. We do have the ability to issue fines for anybody who's not following any of the orders under the Public Health Act, and that's stated in the Health Protection Act. But we're not going to be taking a heavy-handed approach. We also need to make sure that people with valid medical reasons to not wear a mask have equal access to public spaces. I have the confidence that the vast majority of Nova Scotians will understand the need to continue to protecting each other, especially those who may be more vulnerable, simply by being the kind, caring, and compassionate people that the world knows us to be. I believe in the goodness of people, and I'm confident that most Nova Scotians will do the right thing, look after each other, and wear a mask. Premier.
Thank you, Dr. Strang. Chrissy, we'll be happy to answer any questions.
We'll have one question and one follow-up for those reporters that are in the room and on the phone. Today, we'll start with Chris Halef with News 95.7.
Thank you very much. It's a question for Dr. Strang. Actually, you just touched on it right there, the fines. Could you just elaborate a little bit more on that, on the process of fining somebody and how much the fines are actually going to be?
So it's written in the public health order that people who are non-compliant and shown to be non-compliant, they can get fined $1,000. That's there, but again, that's not our primary focus in this. We're approaching this with making sure people have good information, making sure that they have access to masks, and again, I firmly believe that the vast majority of Nova Scotians will do this. We also have to remember that there are some people who have valid reasons for not wearing a mask, and we have to make sure that we're not creating barriers to them accessing public spaces.
You touched on the second wave, the potential second wave a little bit. I touched on this with the Premier a little bit yesterday as well, but I'm just wondering what mistakes or lessons that were made during the first wave will you guys be looking to essentially not repeat during the second wave?
So I'm not sure it's a mistake, but I think we've learned a lot. We've learned a lot more about how the virus. We have much more information about what really are the high-risk situations of where it's most likely where this virus will spread. We also have learned a lot by ourselves and our colleagues across the country, even around the world, about the restrictions that were put in place in the first wave, what worked, what didn't work. So our whole approach moving forward is to have a much more, wherever possible, have a much more targeted approach. Whether that's targeted, it all stems from having good surveillance, but whether it's targeted by geography, a small community, or a specific setting, to be able to move in early and do what's necessary to keep the spread of the virus limited with a much more focused and targeted approach. That's our objective moving forward. It doesn't mean that at some point we may not get to having a much, broader restrictions, but our whole objective is to identify cases or clusters early and have that targeted approach to minimize the need to have more restrictive measures across the board.
Next question will go to All Nova Scotia's Lindsay Armstrong.
For the Premier, can you update us on your conversations regarding reopening to the rest of Canada? How far are we out from potentially reopening borders without the 14-day isolation?
We're not there yet. As you would have seen, New Brunswick has opened up to the Gaspé area in Quebec, but we as a region have not. My fellow premiers from our sister provinces have not agreed to a specific date. I can tell you we are going to have to learn to live with COVID. I'm looking at what is the possible options for us as a province to start opening up, but we're not there yet.
Lindsay, go ahead with your follow-up.
Can you say if you're looking to open up by the fall? And I'd also like to know if the 2 new cases that were announced, be it travel-related and isolated cases, does that affect your decision-making and thought process towards opening up?
Well, those 2 cases that came in, I believe, are international travel that came into our country. No one is suggesting that we'll be opening up to international travel. That is something the national government will have to do. What we're looking at is how do we open up to the rest of Canada. We cannot continue to keep ourselves locked down. There are many parts of the country that are doing as well as we are. So we need to figure out how do we best ensure when we do that, are we tracking people coming in, being able to track them when they're here? If we do find the virus, how do we isolate it, keep it out of our from spreading across the province? But we need to begin to open up our economy and begin to start rebuilding the economic future and the economic health of our province as we continue to protect the public health of Nova Scotians.
Next question will go to Radio Canada's Olivier Lefebvre.
Thank you. I'd like to follow up on that question, Premier. So I'd just like to understand why did you said that you were looking to reopen to the rest of Canada mid-July, but now you say that we're not there yet and there's plenty of other steps to do for reopening?
What we all said is we were hoping to do that together like we did with the Atlantic bubble. That obviously has not happened. In respective provinces, people have different issues. The public is there's certainly a level of anxiety inside of our respective provinces about doing that. But we need to make sure that as we protect the public health of our citizens, we need to now begin to look at the economic health. And how do we open up that in a way that makes people feel comfortable and safe, at the same time moving our economy.
Olivier, go ahead with your follow-up.
So are you putting the economy in front of the health of people then?
Well, that's just nonsensical. It's not something that's not even a sensible question. Of course we wouldn't do that. I mean, it's the reason why we didn't open in the middle of July. We continue to make sure that people are comfortable with it. I don't think there's a Canadian premier or public health official in the country that would do that. That's why we continue to, we made some very difficult decisions about the economic future of citizens of this province to protect the health of our citizens. We didn't take those lightly. We did them because we knew we were trying to save lives. We're not going to go and open up and undo all of the work that people have been doing. Of course we wouldn't. No one would do that.
Next question will go to Global's Elizabeth McSheffrey.
Thank you. Just to follow up on that a little bit, is the fact that we're not opening to the rest of Canada without those isolation requirements, does that reflect the epidemiology right now and the case numbers, or is it more just a conversation? Is it political reluctance or handling people's fears Like, what is the reason that we are still delaying specifically?
I think part of it is obviously continuing to make sure that we can control the virus as it comes into our province. We've heard from citizens who have a level of anxiety. We need to work with that. That's also part of our health. They need to understand as we start opening up that all of the protocols are in place to continue to make sure the public health is the number one issue as we begin to restore the economic health of our province.
Go ahead with your follow-up.
I've got to ask it because it's already being tweeted at me. Why aren't you folks wearing masks right now, and why aren't all of us wearing masks in this room?
That's a great question, because when we came in, we were wearing our masks when we came in. I was going to talk about that in the closing, but thank you for giving me a chance to do it now, and I'll repeat it then. We came through public space. We're now in a confined space. We are, the social distancing is apart from one another. We took the masks off to communicate. It's the same as if those of you who are going to go to church on this weekend, people wear a mask into church, and the preacher will stand up and give his homily, or they'll do that in front of you with the social distancing piece. It's like when we walk into a restaurant today or tomorrow, or and hope all of Nova Scotians decide to go out and have go to their favorite Nova Scotia owned and operated restaurant. You'll wear that mask in, you'll sit down at the table with your bubble, you'll take it off, you'll eat, put it back on to walk out.
Next question will go to Canadian Press. Keith Doucette.
Dr. Strang, I wonder if you could just elucidate a bit on why now with the masks. I'm still kind of fuzzy on that. I know there's a second wave coming. I don't quite know when, I don't think, but it's generally said around the fall. So I'm wondering whether it's linked to the idea that we may soon be opening up to the rest of Canada, and it's best to do it now. Is that also behind the thinking?
Well, it's tied in that every step that we make in opening up, whether it's within Nova Scotia, as we've opened up more activities, changed our gathering numbers, as we open up to other parts of the country, we are introducing some increased risk of COVID. But we also know that that the fall may bring a return. So we need to have things in place, both in the next few weeks and into the next few months that give us the maximum ability to minimize the spread of COVID-19. And as I've said many times, for individuals, it's that package of personal preventive measures that we all need to be practicing and creating environments, whether it's work, public, other environments that actually support us to do that. What we're doing now is adding the requirement to wear a mask in indoors, public places. And the reason for that is we know that indoors is a greater risk than outdoors. And then when you have many people from the public around, the numbers often make it difficult to be absolutely sure that you're going to be able to maintain that physical distance. So we also know that, that we have in the last few weeks strengthened our recommendations on masks. It has led to, I don't have numbers on it, but I'm certainly seeing more Nova Scotians wearing masks in public places, but still it's the minority. So we have some work to do to change the norm around masks, and behavior change doesn't happen overnight. I'm fully understanding that just because we made it mandatory today, and I hope that many more Nova Scotians start wearing a mask today, but it'll take some time to get to the place where as many Nova Scotians as possible are wearing masks. So we wouldn't want to wait until we started to see a return of COVID and then say, okay, now we need to make masks mandatory, because it's going to take several weeks to get the maximum impact of that. So we've backed it up to say, let's do it now, take the time that as the risk starts to increase, we're increasing the protection that we're collectively getting by more and more people wearing masks.
Go ahead with your follow-up, Keith.
Are you happy? Are we doing enough to follow up with people who've traveled from elsewhere and are self-isolating in terms of, we're hearing all kinds of stories around that people are saying, I'm not getting phone calls, they're not checking on me. Are we doing enough?
So we continue to look at how we can do that more efficiently by, automatic means and not having a person making those phone calls. There's certainly room that we can improve in that, and we continue to look at how we maximize that. I think we also need to understand that we are focusing our efforts on a risk-based priority. So our first priority for any follow-up is international arrivals. They're a much higher risk, especially people coming from the U.S. than anybody coming from another part in Canada. So part of it is focusing our resources that we have in the highest risk situations that we have.
Next question will go to Yvonne Colbert with CBC.
Dr. Strang, just to follow up on your comments there, I spoke to one woman who came home to Nova Scotia from Florida, and for the period of 14 days, she did not receive a single call or any contact from the province checking to ensure she was self-isolating. Was she an anomaly, or are we still checking in every day on Americans and others from other countries?
So we certainly acknowledge we've had some gaps and some challenges. I can't say that everybody is getting a call every day, but we're within the resources we have, and as I said, we're trying to shift to some automated ways to do this. You don't do that overnight, implementing those automated ways, but we're working within to make that more effective. One of the things we'll be able to do if we get to the point of opening up to other parts of Canada is focus the resources, as I said earlier, focus on who's the highest risk. The reality is that the majority of people coming from other parts of Canada have some risk, but they're nowhere near the risk of anybody coming from for instance, from the United States. So we need to be able to have a risk-based approach to this as well.
Yvonne, go ahead with your follow-up.
Yeah, so, the Premier has said that we need to control the virus coming into the province, and I guess, Mr. Premier, I'll ask you this question. With, outbreaks in BC, in Alberta, looking at the situation in parts of Quebec and Ontario, how do we possibly ensure that we're controlling the virus coming into the province when there's no requirement for self-isolation?
Well, there were 2 cases in Toronto yesterday. We announced 2 in Nova Scotia today. When you look at the level of risk associated with that, you have to ask yourself, how do we weigh that? When we look at other parts of the country, they've had there's no outbreak at all. So how do we look at the mobility of citizens, and then whether those places where we're seeing a spike take place, how do we track those individuals? British Columbia is doing that currently today. You land in the province, they'll identify where you've traveled from, whether it's inside of Canada or out. New Brunswick now is doing the same thing, and with people coming in from Quebec, the cases are low in Gaspé. They have not let people in from Montreal. That's the kind of work that's being done with public health to address, and really working with technology. How do we best be able to identify and track individuals when they come in? And as Dr. Strang has just alluded to, the number of resources that we require to track everyone, it would make more sense that you would be tracking those who are coming from high-risk areas, as opposed to those who are coming from areas that have equal to or lower risk than we currently have operating in our own province.
Next question will go to CTV's Natasha Pace.
You mentioned the masks were being given out to certain places. I think you also mentioned schools. What about long-term care homes? Where are we with that?
So we've had, for a long time, we've had masks for staff in long-term care facilities. We have long-term care facilities also have masks that support. We require masks now as we've opened up to visitors. So they have masks. So if somebody comes for a visit with a relative who's in a long-term care home and they don't have a mask, they have masks that they can give out to those people.
Natasha, go ahead with your follow-up.
What about the state of emergency? I think that was set to expire sometime soon. Are we planning to extend that, or what would be the latest?
That'll be in place until next week, and then we'll review it at that point. As you know, we can only set it for 2 weeks at a time, and that'll be before us next week. We'll make the decision on extending it or not. But more than likely it'll be extended. There may be some adjustments to it. I think Minister Porter made some adjustments to the order this week around municipal councils. So I would expect it to be extended, but whether or not there's adjustments in it, we'll determine next week.
Next question will go to the Chronicle Herald's Andrew Rankin.
A lot of parents are concerned around the lack of details emerging from the school reopening plan. Can you describe specific measures that will be put in place to ensure that there is no asymptomatic spread of the virus?
Well, you can't guarantee that, but what we have in place is first and foremost where the schools go along with all the other things we've just been talking about. What are your border measures? What are the things that you're putting in place to minimize transmission within a community? And then that decreases the chance that anybody coming into a school is an asymptomatic spreader. But by definition, an asymptomatic spreader has no symptoms. But certain things we have in place. That we will continue as long as we continue to have a 14-day isolation period for people who travel from various parts of the world, whether within other parts of Canada or internationally. We wouldn't certainly anybody who's under those isolation rules would not be allowed to be in a school. Anybody who's been identified as a close contact of a previous case, they're in isolation for 14 days. They wouldn't be allowed to be in a school. So we do wherever possible. People who are at higher risk of being exposed, we'd follow our rules. They would not be into a school setting. Along with that, we have very clear instructions that are broad symptom lists. So anybody who has a range of a number of, frankly, very common symptoms that could be from a number of causes, we're saying that if they have any of those symptoms, schools, like other places, they need to stay home, do the 811 online assessment, and get direction about whether they need to be tested or not. And if they are being tested, they need to stay home until they get the result back. So that first step of people who are unwell not coming into a school like any other, and we're saying it for any other place, anybody who's unwell needs to stay home until they've been assessed and had and been cleared with a test if appropriate, and have a negative test. That's an important way of keeping virus out of a school. And then all the steps we have within a school, like other places, keeping groups of kids in classroom cohorts, enhancing hand washing, all those other measures. Even if there is somebody who is spreading, it may be asymptomatically in the school, all those other steps will minimize the number of people that they could spread it to.
Andrew, go ahead with your follow-up.
Because the province isn't enforcing the mandatory mask rule, the responsibility then is on the business workers, like at grocery stores, at Tim Hortons. Don't you feel that's a very unfair burden to put on these people? And what kind of support will be offered to workers to ensure that they have the resources and they can do this?
Well, Andrew, you're making an assumption that we've downloaded that burden on the businesses. I've made it very clear to them that we have not downloaded that assumption onto them. So we said we asked them to cooperate with us with signage, making people aware. But at the end of the day, we're not saying to businesses that we're expecting them to enforce if somebody wears a mask and they say they have a medical reason for not wearing a mask, we're going to take them at face value, and that's what's been communicated. As I said earlier, I've had several largely attended webinars with business and other communities, and I made this point very clear to them. So I don't know where you're coming with the assumption that we're downloading from.
I'm now going to go to the phones. The first reporter on the phone that will get a question is Kyle Shaw with The Coast. Kyle, go ahead.
Thanks, Chrissy. So the Coast is hearing reports of people driving into Nova Scotia from Quebec and Ontario only to be waved through at the border with no instructions about quarantining. And at the same time, it's becoming clear that a lot of university students are planning to return to Nova Scotia in the fall, even if their classes are online. So you've talked some today about deploying limited resources around quarantinings and check-ins, and I want to get into this around the students. What are you going to be doing to ensure this mass migration of students are following proper protocol upon arrival?
So I had a conversation with Council of University presidents yesterday. They've all submitted plans which are in the process of being reviewed, and all of their plans have clear details around laying out expectations for students coming in from outside of Atlantic Canada would be required to do, whether it's on campus or off campus, required to be quarantined. They have to agree to that under a student code of conduct. We're working with universities about how we operationalize that and find ways to monitor that. There's some things we're going to potentially bring to the table to support them. But it's been made very clear from the outset for students coming in outside of the Atlantic provinces, whether we still have an Atlantic bubble or not, once they come here to go to school, they're going to have to undergo a 2-week quarantine period. They will be supported in how they do that, but that expectation is being made clear. There continue to be ongoing conversations between the provinces and territories and the federal government about the same kind of approach, and with international students who would be under when they come here, their first 2 weeks would be under the responsibility of the Federal Quarantine Act. So we continue to have discussions with the federal colleagues about the roles and responsibility in that regard. So there are very active active work going on to, at the point you've identified, is the increased risk of students, making sure that we have the things in place that, that monitor them for the first 2 weeks that they're here in the province.
Go ahead with your follow-up, Kyle.
Okay, and similarly, I want to dig into the student perspective on the questions that have come up today about when the quarantine requirement might be dropped. You know, since we know this wave is coming in September in just a few weeks, can you commit to keeping the quarantine requirement in place for the next month, at least until they arrive?
Well, as I said, the commitment, the discussion I had with the university presidents is that even if the Atlantic bubble disappears, that they under their student codes of conduct, they would still be requiring a quarantine period for students coming from outside the Atlantic provinces.
Next question will go to Yvette D'Entremont with the Halifax Examiner. Yvette, are you on the phone? Moving on to Jean Laroche with CBC.
Hi there. I just wondered, Dr. Strang, you mentioned in your talk that you were not going to be supplying masks indefinitely. Two-part question. One, how many masks do you plan to distribute or have you bought for distribution? And when will you stop distributing them?
So I don't have those numbers. We have well over 1 million non-medical masks that have been stockpiled, and I don't have the exact number, but we're distributing a small portion of those. We don't have a definitive end date to that as well. Part of it is the group that's working on this will be looking at the uptake on. So when we give masks out to museums and libraries, we'll be looking about what is the usage of masks through those routes. So there's no definitive end date. I just think that when we're saying it's there that it's not going to be on an endless timeline, reflecting the fact that these are non-medical reusable masks that have a long lifespan with them. Our goal is initially to take steps to make sure all Nova Scotians have masks, and then they have those masks for a long period of time.
Sean, go ahead with your follow-up.
And I just want to explore what my colleagues have also explored in terms of the mandatory nature of this mask. And you would know, Dr. Strang, monitoring social media, people say if you don't enforce it, it's not really mandatory. And, you know, seatbelts are mandatory, and not speeding is mandatory. Passing a school bus is illegal. But if you don't have enforcement, people continue to do that. So can you square the circle for me about how can this be mandatory if you have no enforcement?
Well, the mandatory creates a standard that we're expecting people to meet. And ultimately, we do have the ability, as I said, under the Health Protection Act with local law enforcement that people can be fined. But I fully believe that the vast number of Nova Scotians, if we help them to understand that them wearing a mask is about keeping themselves, their neighbor, their family, their healthcare worker who may need to be there to look after them, keeping each other safe. I fully believe that the vast majority of Nova Scotians will do the right thing, that we shouldn't need to have a strong compliance and enforcement approach to have people do the right thing.
Going back to Yvette D'Entremont with the Halifax Examiner. Yvette, are you on the phone now?
I am. Thank you, and sorry about that. My first question is for Dr. Strang, and I know that you've addressed the issue of what constitutes an indoor public space. Apartment buildings house many school-aged children who will be returning to school with their peers in September, and that's led some people to question why common areas in apartment buildings like hallways, laundry rooms, and lobbies aren't explicitly covered by this mask mandate. I know that your list specifies common areas in tourist accommodations and office buildings, but not apartment buildings, and I'm wondering if maybe you can just explain why.
So those are talking with lawyers, or as we drafted this part of the public health order. Clearly, those are private spaces that don't have ready access for the public. The vast majority of rental buildings like that, you need you need to have a pass to get in. You have a code if you're a rental apartment to get in. It's not that I can just walk in and go into that common space. So they don't have ready access for the public. We don't expect to have the general public in those spaces. So that as we work through the legal definition around things, we came to the understanding that those didn't fit the definition we were using of an indoor public space.
Yvette, do you have a follow-up?
Yes, I just have a quick question for the Premier. I'm just wondering if there is any economic modeling around looking at reopening the border, and if so, what does that look like versus loosening restrictions and keeping the border closed?
Well, we all know, quite frankly, that the commerce and the activity happening within our economy has been greatly restricted, and particularly in our province when it came to the service sector. As you know, if you look at the restaurants here, for example, in our capital city, without the cruise ships, we've seen some uptick in activity with the Atlantic bubble, but there's no question, particularly some of our larger iconic tourism sites, that they would attract people from other parts of the country. Tourism has great data on where a number of our tourists have come from over the last number of years, which were both record years. A large percentage of that is outside of Atlantic Canada. So there's no question there would be an economic benefit to it, but we will continue to monitor it to make sure that we can ensure that as we open up, all the protocols are in place, continue to put public health at the forefront of any decision we make.
Next question will go to Steve McKinley with the Toronto Star. Steve, are you on the line?
Yeah, I'm sorry. I just had to get myself off mute there. I'm just wondering, you said you've been having conversations with the other premiers about when you might think about opening up Nova Scotia to the rest of Canada. How would you characterize those conversations, and at what point would you consider going alone if the other premiers don't agree?
Well, first of all, the conversations that I've had with the Atlantic premiers has always been about the health and safety of Atlantic Canadians. Premier Higgs spoke to all of us about opening up to the Gaspé, looking for our thoughts and opinions on it. I supported his decision to do that. They have in place tracking mechanisms that would deal with the citizens coming into their respective provinces. The question became for all of us who just weren't ready to open up to the rest of Canada at this point. But I've said all along that we cannot wait forever. We're going to have to ensure that we open up our province, and as I said, I'll continue to work with our public health as my fellow premiers are working with theirs, and we'll make decisions with public health on when we can start opening up the economy to other parts of the country without that 14-day quarantine.
Steve, do you have a follow-up?
Yeah, when you do get to that stage where you decide that Nova Scotia does have to open up, what is that going to look like, especially considering a lot of that traffic has to come through New Brunswick?
Well, no, if you're driving, you'd have to come through New Brunswick, yes. A lot of air traffic comes into our airport. As you know, Halifax is the hub for much of Atlantic Canada when it comes to traffic in and out of the region. We are the largest economy in the region, so much of that traffic would come through air. So we'd be working with our airport. How do we best track those coming in to ensure where they're going? And if there are people who we feel need to be isolated, we would have the capacity to be able to do that. So there are many protocols in place now, and we'll continue to enhance them as we continue to take down some of that restriction.
Next question will go to 6 Rivers News, Bill Martin.
Thank you. A question for the Premier. We are very grateful, in fact, for the steps taken thus far that have ensured Nova Scotia and, generally speaking, Atlantic Canada to have really tamped down the COVID virus. Unfortunately, the epidemiology in the rest of Canada has not kept pace. In fact, evidence suggests that the infection rate is rising in Western Canada. And notwithstanding all the questions you've already had about when and why, I want to encourage that you've said from the outset that epidemiology will guide you, not politics, not the economy, and I hope that's still the case.
I can assure you.
Bill, do you have a follow-up?
I do for Dr. Strang. Some time ago, a few weeks back, Dr. Strang, we wondered about the possibility of coming up with a fairly comprehensive report on the history of the infections across Nova Scotia. I asked about the possibility that be done by county as opposed to health zones. You said you would consider it. I'm wondering where might you be at with that?
So we've looked at that, and if you go into by county, we run into issues about small numbers for a limited geographic area, and then there's always the concern around privacy and disclosing personal health information. So we continue to stay focused on reporting numbers by the 4 health authority zones.
That's all the reporters that we have on the line and in the room. I will go back to the room if there's any points of clarification. If somebody wants to just give me a sign. Lindsay Armstrong with All Nova Scotia has a point of clarification. Go ahead, Lindsay.
I'd just like to clarify the second part of my follow-up. If the fall looks like a reasonable time where Nova Scotians can expect that the province will have opened to the rest of the country without isolation.
We have not set a date and time. We're continuing to look at that. As was asked in one of the previous questions we've been really looking at that since mid-July with our sister provinces, but we've not set a date for that as of now.
Elizabeth McSheffrey with Global has a question of clarification.
Just a point of clarification on the question about why we're not wearing masks right now. If it is the best practice and the safest practice, why aren't we leading by example here?
Well, the reality of it is we are. You wearing where the most potential risk of having that virus. That is when you're moving about, when you're not 6 feet apart. All of those things. When we come in, everyone. I wasn't here when you all walked into the room, but I see masks on your desks. I'm assuming everyone was wearing a mask when they came in. When you separated from one another, you sat down, you took your mask off. The same thing Dr. Strang and I have done, and it's what we're recommending for all Nova Scotians to do. It's why when you go into a restaurant, you sit down at that table, you take it off. If you're walking around a grocery store, you keep it on.
Next question of clarification will go to Chris Haleff with News 95.7.
That's kind of like, on Elizabeth's point there, but just in terms of mandatory masking inside public places, how does that apply, just to clarify the rules around pastors or live performers like musicians, for instance?
So we've made it clear that added to the order that anybody in the language is a performer or an officiant at an event that's defined in the order. So special events, worship services, arts and cultural events. If they're doing an activity, that vocalization is required, necessary part of the activity. So talking, singing, etc. They don't have to wear a mask for that purpose, and that kind of goes back to your question. We have a key part of communication is the point of these events. So we're making sure we're separated, but we're to make sure we have good communication. We're taking our masks off while we're here sitting talking to each other. As soon as we stand up, our masks are going to go back on.
And that's all the time that we have for questions today.
Thank you, Chrissy, and I appreciate all of the.
That's all the time we have for questions today, Keith. Thank you.
Thanks, and I appreciate the questions about the masks, and I appreciate you communicating the question from many people who were online about why we would not have been wearing them as we did when we came in. Dr. Strang and I came through a public space. We actually came down the elevator. And when we sat down, we separated ourselves by the 6 feet and we took them off, and we're distanced from the people in the room as people are watching. And as Dr. Strang has just said a few minutes ago, public speakers will be allowed to take their mask off when they're standing in front, but they will have that 6 feet, at least that 6 feet of separation from either their congregation or the people that they're with. And as Dr. Strang said, when he and I leave, we will actually put our masks on. I also understand being told to wear a mask is uncomfortable for some people. The decision to do this has not come easy for Dr. Strang and his team. But making masks mandatory indoors is the right thing to help protect one another. It's not the only way, but it's another layer of protection. I've said this time and time again, we need to learn to live with COVID until there is a vaccine. And wearing a mask on public transit, indoor places, and when you can't distance outdoors must become part of our daily routine. When asked to when someone is wearing a mask, they are protecting you. So why wouldn't you wear one to protect them? This is about being kind and caring for one another. Most of all, protecting each other during these very, very difficult times. We're heading into a long weekend, and I encourage all of you to get outside, visit with your bubble, and think local, buy local, and support local. And if you go inside into a public space, don't forget to wear your mask. Have a great Natal Day weekend.